Biodynamic Craniosacral Therapy is a gentle, non-invasive hands-on treatment used to relieve pain, stress, and trauma in the body. There is no manipulation, expectations, or judgments. The practitioner doesn't send, take, or channel energy, but holds a peaceful, neutral space for even the most traumatized individual to be able to release unresolved shock or trauma. Oftentimes, it is difficult to express, understand, or even remember the incident that caused the trauma, like with a baby that had a difficult birth. Daily, our bodies endure stresses and strains that the body must work to compensate for. These stresses often cause our body's tissues to tighten, thereby altering the craniosacral system, causing tension to form around the brain and spinal cord, resulting in restrictions and blockages. This, in turn, creates an imbalance in the healthy performance of the central nervous system and potentially, overall, every other system it interacts with, because the body functions as a complete unit. Fortunately, such restrictions can be detected and assisted using simple methods of touch. With a light touch, the CST practitioner uses his or her hands to evaluate the craniosacral system by gently feeling various locations of the body to test for the ease of motion and rhythm of the cerebrospinal fluid pulsing around the brain and spinal cord. Different holds are then used to release restrictions in any tissues influencing the craniosacral system. A CST practitioner listens to the primary respiration, which refers to the way the body expresses tide-like rhythms in a way that may be best described as inhalation and exhalation. During the inhalation phase, a subtle motion occurs in fluids and tissues, which rise upwards and at the same time expand from side to side, while shortening from front to back, oriented around the midline of the body. During the exhalation phase, the opposite occurs, a motion that generally recedes down towards the lower part of the body and narrows from side to side. There are 3 different tides that the practitioner tunes into. The cranial rhythmic impulse, or CRI, describes a slight involuntary rocking motion of all fluids, bones, tissues, and organs in the body. The CRI occurs at an average and variable rate of between 8 and 12 cycles each minute. The mid-tide, or fluid tide, has a flow of about 2.5 cycles per minute, while the long tide is the most formative level of primary respiration and is a slower, deeper rhythm of about 50 seconds for inhalation and 50 seconds for exhalation. The long tide is steady and is a fundamental resource for even the most traumatized individuals. Craniosacral practitioners tune into the frequency of these primary rhythms and with various holds negotiate a relationship for healing to unfold. The breath of life flows from our innermost essence, unfolding in 3 tides. Yet within us lies a pure state of being and tranquility, unaffected by our individual characteristics, personalities, or actions. Dynamic stillness serves as our fundamental nature, lying beneath all else. By quieting ourselves and turning our attention to the origin of our actions, we can catch glimpses of this dynamic stillness. In this state, duality dissolves, and there is no separation between subject and object. It is here that profound healing can occur. In biodynamic craniosacral therapy, it won't look like the therapist is doing much, because the real work occurs at a deeper level, where the therapist is assisting the recipient to achieve a sense of calm in resting in their own natural wisdom. The primary respiration and the innate wisdom of your own body does the healing work. The body knows best, and this is called the inherent treatment plan. In stillness and allowing states of harmony, tissues are reorganized and feel warmer and more comfortable when unresolved trauma heals, and primary respiration and its tide-like motions may express stronger and clearer. The nervous system may then resolve its activation, and the body will express with greater ease and flow. Unresolved history heals, tensions and blockages are released, and flow returns to places that felt stuck, numb, and cold. At the end of a session, the body's life forces and potency are more attuned to their natural organizational, protective, and healing abilities, and the body, indeed the whole person, is better resourced to resolve health issues in a natural and holistic way.